UWITV now presents a special COVID-19 Symposium hosted by the Caribbean Public Health Agency CARPHA on March 11, 2020 in Trinidad and Tobago. Part 1 of the symposium features presentations by Dr. Joy St. John, Executive Director of CARPHA, and Dr. Lisa Indar, the Assistant Director of Disease Prevention and Control for CARPHA.
I would, though, like to invite our Executive Director of CARPHA, Dr. Joy St. John, to address you on COVID-19. She will talk to you about the facts of the matter, COVID-19. Dr. St. John, please welcome her.
And thanks to the media who are here in the room and those who are joining us online. The presentation is going to give you an overview of what is happening in COVID-19 specific to the Caribbean, but I really wanted to start with a quote, and it's about the fake news that's circulating. And I really am glad for this opportunity for the press to get an idea of what is real, what is credible, and your very clear and specific role in making sure that as the Caribbean deals with the outbreak, the global outbreak of COVID-19, because it has not yet been declared a pandemic by WHO, your role in making sure that the Caribbean comes out of this not only with minimum loss of life and minimum death and minimum illness, but also with as intact an economy as possible. So I'm going to speak about where the world is now, what is being done at the regional level, what can we do as individuals, and also your specific role as the press. And you're all aware of the fact that COVID-19 started in Wuhan, China. On the 4th of January, CARPHA alerted the chief medical officers. Very soon after, WHO declared a public health emergency of international concern on the 30th of January, and confirmed cases of COVID-19 were announced on the 1st of March 2020. CARPHA has raised the risk level for the region from moderate to high to very high. We raised that on Friday gone. But I need to tell you that the projected spread of COVID-19 is that everywhere there will be at least an importation by April 2020. So what do we know? This outbreak probably arose from an animal, so that's what zoonotic origin means. Person-to-person transmission has been established in quite a few countries outside of China. There is no vaccine, and trials to get a safe vaccine are at least months away, if not a year or more. And there is no known treatment. But again, there are trials of drug cocktails, including drugs used against HIV. So as of 9:33 this morning, there were 121,605 confirmed cases. And if you check now, I'm sure there are thousands more, because the rate of spread of this virus is quite high. We're getting a doubling time of between 3 to 6 days. And in January, it was estimated that the doubling time would be 2 weeks, but it's fallen to 3 to 6 days. And on the right, you will see, for me, a very important diagram. There are two epidemic curves. The one in red is where you have a very high peak of illness in a very quick time. And this is without protective measures. And you see the dotted line, that refers to the number of cases that the healthcare system capacity can manage. So without protective measures, you will have this sharp rise in cases and overwhelm the health services and probably negatively affect other sectors. But with protective measures, which we will go into more, you can allow for illness but at a rate that can be managed in the healthcare system. And so it's more likely that people will not die. We've looked at the phases of this outbreak. The phase that Trinidad is currently in, and most of the rest of the CARICOM countries, except for Jamaica, is preparedness, because there is no confirmed imported case. And the best case scenario is that other countries, including now Jamaica, can stop the spread before it gets to a particular country's shores. But the worst case scenario is that it is transmitted to the other CARICOM countries. And I think we already realize, because COVID is spreading so fast and it's contagious, that we are going to get there. We are going to get to importations. And the next phase is importation. When this novel virus comes into our shores, because remember, it's not been seen before. The best case scenario is that it's recognized at the ports of entry, and persons are either quarantined if they're not showing symptoms, or isolated if they're ill, and it's stopped prior to entering the community. The worst case scenario is that it's missed by all authorities, and we start to get disease into the community, and then we have the transmission phase. The best case scenario is that it's caught in those pockets. Authorities are able to contain, and there's no start to the overwhelming of the services. But the worst case scenario is what was seen more recently in Italy, where there's sustained transmission all over, and there's a loss of capacity to treat. So there have been some travel advisories, mainly advisories, but some countries, not many, did have bans within CARICOM. And of course, we had the issue of the cruise ships, which sent shockwaves not just in the Caribbean, but around the world. So what have we done in the CARICOM region? The first thing is coordination, because the more likely we are to coordinate what we do, the better we are to survive this. So the objectives of the Caribbean response are not only to prevent importation of a case, but to bring order and coherence to the responses of the health and non-health sectors as this outbreak evolves. So the collaborating sectors that we've been working with, of course, tourism, immigration and customs, security sector, business, education, and the last one isn't a sector, but you know the importance of maintaining governance, and you've seen already that in some countries, ministers of health and congressmen have become, and women have become ill. So governance. At the CARICOM level, 2 emergency meetings of the Council for Human and Social Development, the Ministers of Health were convened, and there was also an emergency meeting of CARICOM heads of government to discuss COVID-19 specific responses. CARPHA's response has been varied. We have produced general documents, media releases, as well as guidance to the member states on things such as the health sector response, ports of entry, travel, etc. Situation reports, we're up to situation report 20. And of course, we have been doing testing. CARPHA, along with 8 member states, have been designated by PAHO WHO as testing locations. And so far, we have tested 52 patients, no positive tests for COVID-19. So now we come to your areas, communication. Lies spread faster than facts. So true in this outbreak. Up to last night, I was being sent fake news about one of our countries and how many people in a family were in hospital and dying. It was all fake news. So we need to pay attention to sources of information which are credible before disseminating. Some of the accredited sources of information, of course, CARPHA, PAHO, the Americas Regional Office for WHO, and WHO headquarters. See, these are some of the communications products from CARPHA. We have communications focal points in each of our CARPHA member states. And these are some specific things for the media. Motivate audience members to cope with the challenges they face. Some people are very scared and overwhelmed, but the way in which you communicate the information can help them to see their way through. Help communities to access health and support services, of course, countering dangerous rumors and misconceptions, helping to reduce stigma towards people. There's been a lot of stigmatization of some countries, and helping audience members, including yourselves, to remain healthy. So each of us has our own individual health to take care of, and these are some of the things. Hand hygiene, washing your hands frequently, or using alcohol-based rubs if your hands aren't obviously dirty. Social distancing. It used to be 1 meter, but we're noticing that now we're talking about maintaining 2 meters of distance. So all the hugging and the kissing has to stop. And if you are coughing or sneezing, there's this whole thing about, we call it respiratory hygiene, I call it cough etiquette. Cover your nose and mouth, use a tissue, dispose of quickly, or sneeze into your elbow. Avoid touching your eyes, nose, and mouth. Have I touched my eyes, nose, or mouth since I started? Thank goodness, because I have the habit to do that. I have to learn to stop it. Of course, if your symptoms are severe or they start to worsen, seek medical care early. But that is, you call ahead and you go to your designated center, or you go to your GP who already has signage to separate people who are suspected of having COVID-19 from other persons, because you know, of course, those with chronic diseases are more at risk of developing severe illness. And then finally, staying away from work or school if you begin to feel unwell. Don't spread this. So thank you, ladies and gentlemen, and I hand over to Ms. Curtin.
Thank you, Dr. St. John. At this time, it is my pleasure to invite Dr. Lisa Indar. She's the Assistant Director of Surveillance, Disease Prevention and Control at CARPHA to address you. Dr. Indar?
Members of the media, good morning. All protocols observed. I would speak to you on our guidelines that we have for control is still the biggest thing, and I will then concentrate on some prevention messages for our hoteliers and our frontline staff. So Dr. St. John would have given the situation update. The main thing I want to re-emphasize here is that, yes, we have reported cases in the Caribbean, but these are imported cases and they're all travel related. We don't have any transmission in the Caribbean as yet. All right. We know of its zoonotic origin and person-to-person transmission. We know that there are currently no vaccines. We at CARPHA is the lead, has been given the heads of government lead, or the lead at CARICOM for leading a health emergency response. And because of that, we started very, very early by activating our incident management team on January 21st, as early as that. And we would have also activated our regional coordinating mechanism for health securities, which is all our regional and international agencies, as well as member countries, where we look at discussing a harmonized response towards prevention and control. The risk has changed to very high, and that's because not only of what is happening out there in the number of increased cases of transmission that is occurring among countries, but now we have these countries that has sustained transmission with direct flights to the Caribbean. So that's why the risk has become higher. So what does that mean for us? We need to be even more proactive at ports of entry. So people arriving by airplanes, people arriving by ships, people arriving by yachts, then will be subjected to more vigilance in terms of when they're entering. And with that, countries then would have issued travel advisories to help protect or to be more protective at ports of entries. So this document really speaks about some of the major information you would have for travel-related guidances as well as ports of entry guidances. So I urge you, go to CARPHA for the information. We are updating our information every 2 days, so you should see this information online, and it really speaks out in details, what are the different guidelines for ports of entry, for ships, for aircrafts, guidelines for travelers. We know when it comes to travel and tourism, tourism is our bread and butter. And the thing is, though, what is more important is the spread of COVID or coronavirus is really travel related. So we cannot overemphasize the prevention measures that Dr. St. John spoke about, keeping your social distance, 1 to 2 meters, and hand washing, even cleaning surfaces very frequently. What happens then if someone does come? And this has been a question that has been asked by a lot of persons. There is a standard algorithm. If you do have a person coming from a country where there's sustained transmission, or a hotspot as we call it, we have a set guideline or algorithm to follow. If that person is not showing any illness, anybody that is coming out from a hotspot, they obviously should self-quarantine if they're not showing any sign of illness. If they're showing sign of illness, a sample would be taken and tested. If it's negative, we do not follow up more. If they're positive, then we have to do something called contact tracing. So I hope that clarifies, so that if a person is positive here, then we would do a tracing of all the persons they would have been in contact with afterwards. What are countries then doing? To be prepared, countries have varying methods, and this is important for the way how they actually guide in terms of travel preparedness. The first really is ports of entry, being proactive at your ports of entry. And every country has a sovereign responsibility and a sovereign right to decide what measure they take. So it's not CARPHA taking these messages, it is creating these advisories. These are the country's sovereign decision that they would have issued. Now, some of the travel advisories, as you would probably see, that are being published, may or may not include all the hotspots, or they may include more countries than those hotspots that has been reported. But that, again, is based on a country's own assessment of their risk level and their assessment of being able to manage a COVID case in the country. So that's important to know. So these travel advisories vary from actually denying entry to someone who have come from a hotspot, or if they have, banning someone from even starting that particular travel. We are monitoring. CARPHA I want to tell you, CARPHA is also taking a proactive approach. We also are doing this through our Travelers Health Program, which is monitoring our visitor illness on a real-time basis. So we have this electronic web-based system, so we are monitoring as much as possible. And this particular program as well is working not just on the health side, but really with our hotels, and working with our cruise ships as well. So we are doing all that we can to monitor and provide updated information. We also just created a task force between the Caribbean Tourism Task Force between the Caribbean Hotel and Tourism Association, the Global Tourism Resilience Center, and the Caribbean Tourism Organization. And I'm telling you this to let you know that we are coordinating not just on the health side, but really with our tourism stakeholders to make sure the right message goes out. So what are some of these travel advisories? Well, to date, the WHO has not issued any travel advisories. So that's important to know. CDC has issued travel advisory, the Center for Disease Control. They have 3 levels of alert. One is level 3, which is the highest. They're telling you to avoid non-essential travel. Just recently, in the last couple of days, the CDC would have issued non-essential travel level 3 alerts to more countries. In addition to China, they would have added Italy, Iran, and South Korea. So non-essential travel is non-essential travel. Then they have level 2 and level 1 alerts. So level 2 alerts is that you practice caution if you really have to travel. And level 1 alert is, of course, level 2 is enhanced caution, and level 1 is normal caution during travel. So that's the CDC. And then within, you have countries that also issue travel advisories. So for instance, you may have seen Italy is on totally lockdown. Israel has just issued a travel advisory that, anyone who is coming into their country, regardless, are going to be on lockdown or quarantine. And then we have individual travel advisories. So we have a running list that we also send to our key partners that really is divided like this. Most of the countries then would have advisories of some of the more common areas where there's sustained transmission. So China, Hong Kong, South Korea, Singapore, Italy, Iran, Japan, and of course, there are other individual countries may have additional ones depending. So it actually says either non-essential travel or denying entry to a person who have traveled to countries with local or sustained community transmission in the past 14 days. That's the general thing. But individual countries, some of them have 21 days and some have 28 days. And that's up to the country's right to do that. Most have been 14 days. So person arriving with a history of travel from these countries that they have travel advisories from in the preceding 14 days would be 1, either denied entry, or if they have arrived and they're already in the country, they would be quarantined if they're not showing any illness. Or if they're showing illness, then they'll be isolated in a health facility and treated. So that's the 3 things that may happen. Okay. This differs, though, for if you're returning citizens. All citizens must be allowed to repatriate. So if you are coming in from one of those countries, like a hotspot area, you would be, and not showing illness, you would be quarantined. You'd be asked to self-quarantine. And that may be 14 days, depending on some countries, or 21 or 28 days, depending on the country's advisory. If you're coming in and showing signs of illness, obviously, then you would then be isolated and treated. And if by chance you turn out to be positive, then we do contact tracing. Okay. What are the different guidelines for airplanes and cruise ships? Well, people have been asking the questions, which is higher risk of travel on airplanes is a bit lower than on ships because of the whole ventilation system in the airplane. So I want to go through all that. But the thing is, you are spending less time in an airplane, you're in contact with less persons, so the risk then becomes less. On a cruise ships, though, it becomes a little bit more because obviously you are spending a longer duration, and as opposed to an airplane where you may have 300 to 350 persons, you are dealing with 3,000 to 6,000 persons on a ship. So the risk of contact, or the risk of likelihood of contact becomes greater. More persons are in contact, there's central air circulation, and longer duration of travel. So you may have been seeing a lot that's happening with cruise ships. In the last couple of days, CDC just issued advisory that this is for the U.S., avoid non-essential travel, meaning on cruise ships, and persons who are sick or older or with underlying illness should not travel on a cruise ship. Countries also have their own advisories, and most countries, if you're coming from a hotspot area, they are not allowing you to disembark. We have been working with our heads of government, as mandated by our heads of government, to develop a regional protocol for coordination of the management of COVID-19 and other infectious diseases for passenger ships. And All of this is based on CARPHA's regional guidelines through our tourism and health program. We have regional guidelines for responding to public health issues on ships, in hotels, aircrafts, and so on. And these are published documents. And this was long before COVID, but it deals with just how do you deal with public health issues. But just to reiterate some of the key things, the ships then should send the information correctly. They have something called a Maritime Declaration of Health form, which really lists, passenger manifest as well as if person is ill and where they're coming from, the type of symptoms. So therefore, the country gets to make an informed decision. That information comes to them, should come to them 12 to 24 hours before, and it should be accurate. And then the country makes a decision whether to grant a ship to come in, which is called practique. Countries, on the other hand, must also make sure that their travel advisories, which have been updated as we go, just last night we had some new advisories, that those advisories are shared with the ships. Also, countries in these protocols have noted the Caribbean countries, because of their capacity to deal with COVID-19 cases, they have indicated that persons that are coming in and with preceding travel in the last 14 days from countries where there's travel restrictions, they would not be allowed to disembark. So standard advice, I wouldn't go through that. General message to travelers, of course, we know avoid travel for countries with sustained transmission, and no travel advisories before you travel. Hoteliers, we are asking the hoteliers to do the same, if persons are sick, same thing that with the standard public messages, keeping social distances. If you are sick, stay at home. That's important. Anybody who is sick, stay at home. That's the biggest one, and of course, all the different prevention messages. What we're also advising hotels to do is to routine cleaning and sanitizing, and of course, swabbing, environmental cleaning, to make sure that surfaces, contact surfaces are properly cleaned. Same for frontline workers, making sure that they are protected, know that they can use proper protective equipment when necessary, making sure that they are aware of the different travel advices, making sure they know how to deal with a suspect case, with a non-case, and with how to transport and how to be able to isolate if necessary. So I think that's it. I want to end with this. We are doing a lot of communication messages. Feel free to go online, and there's a whole communication package that's going through to the communication network, so feel free to disseminate.
Thank you, Dr. Indar. I would like to open up the floor, given that we just had two presentations. I would like to open up the floor so that if you have any questions for Dr. St. John or Dr. Indar, please, this is your time. You can ask some questions. We will cap it a little bit so we won't go too long, because we don't want to encroach on the time for our roundtable discussion. But I invite you now to ask questions to the presenters who just had a bit of a conversation with you. We will also be taking questions from our Facebook live stream, and these will be also addressed in this forum. So the floor is yours. I did notice one of the questions from the Facebook, though, asking about if someone wanted to do a test, what is the process? If the person wanted to test for COVID-19, what is the process? Dr. St. John will take that question.
They should go to their provider that has been either identified by the country, because some countries are putting on what we call flu clinics, or they have designated centers where testing and other things to do with COVID-19 are going on. Some other countries have arrangements where the private doctors and the primary care facilities are also locations for testing, but they have, for taking the sample, I should say, but they have signage to separate persons with COVID-19 from the most at risk among us, those with chronic diseases. So you should go to your provider have a sample taken, there are specific ways in which the sample should be packaged and sent to the public health laboratory. There's a designated center within each of the countries that are sending samples to CARPHA, and then there are some countries, 8 countries, that have actual testing in their country. So there would be arrangements for getting the sample from the public health laboratory to the testing location. Here in Trinidad, it's CARPHA. So that is the arrangement to go about. You're not to go to the testing center and get your swabs taken and then have it the sample tested. You go to your provider, your healthcare provider, the designated one by country, or your private doctor, and then the sample is taken, transported or shipped to the testing site, the designated testing site. It's not any and everyone can do the testing, and then it is tested. CARPHA has 2 stages, a screening stage, and then if the screening test suggests COVID-19, we have a confirmatory stage. That is to rule out false positives and false negatives.
Thank you, Dr. St. John.
My name is Andy Johnson. I'm here from Power 102 FM. Should there be penalties for persons who conduct these tests in private institutions, as reported by the Minister of Health yesterday?
The way in which each country would deal with persons who are not following the dictates of the testing is up to the country. I am not sure how any particular country wants to deal with it. In our case, when we realized what was happening and that our name was being used to indicate that we were supporting that type of thing, we issued a press release. So the whole issue of going further than that is a country decision.
Thank you, Mr. Johnson. Thank you, Dr. St. John. Please.
Hi, morning. Rashad Khan, Guardian Media. Dr. St. John, I saw that you said that 52 patients were tested for the coronavirus. Is that regionally? Is that a regional figure?
Yes, so we're not only testing for Trinidad, but I will tell you that Trinidad has the lion's share of those requests. We have 26 member states. There are 8 countries apart from the location where we are now, Trinidad, that have testing capabilities, so they have been doing their own tests. But some of the others have been sending samples to us.
Okay, because I'm just referring to the release that the Ministry of Health sent out this morning stating that 40 persons from Trinidad and Tobago would have been tested. And then would you be able to say if the 12 that there are in the region so far would have been tested through CARPHA?
Beg your pardon? The 12 that there are?
The 12...
The number of tests that I have told you is the tests that we have done for Trinidad and other countries.
Okay, but what I'm referring to is the 12 persons within the region who would have tested positive for the virus, and that's from Martinique and all these other countries.
We Martinique, St. Bart's, St. Martin, Dominican Republic, the other Caribbean countries are not our member states, so we are not covering those.
Okay.
The only positive in the CARICOM space that we cover is Jamaica, but Jamaica is one of the countries that has its own testing capacity. The other countries, they had their tests done. I know Guadeloupe in one, but I'm not sure about the others.
Okay, thank you. That's exactly the clarification I was looking for. Thanks.
Good.
Thank you.
Can you,
Yes?
Tony Fraser, can you say from CARPHA's knowledge if the public and private institutions, health institutions in Trinidad and Tobago and indeed across the region are equipped to deal with somebody coming in with seeming to have the virus? Somebody's in a bad state, fever, cold, etc., etc. They've come to the hospital. or private institutions? Are they able to deal with that individual?
So what I can tell you is that CARPHA has issued guidance on how the health sector can not only deal with a case but organize itself. And when I say organize itself, I mean that same thing that I spoke about. Either giving guidance so that private GPs can do it, or having designated centers, etc., etc. In terms of if there has been the transfer of that information to every private doctor or every private facility, that I can't tell you for every member state. I just know that guidance has been given, and we have also been not just giving paper, but also having discussions with countries.
Hi, good morning. Nika Parsonal from Loop TT. I just want some clarification on the timeline. Is it that there are multiple CARPHA locations spread across the member states? So, because you keep saying that they send test samples. So do they send them to Trinidad and Tobago to be tested, or do they have their own locations?
The only location for CARPHA that is doing testing is the Medical Microbiology Laboratory right here in Port of Spain, not far from here.
How long does it take for these member states to get their results?
Once we get the sample into us, and sometimes that is a function of how long it takes to get from the country to Trinidad, because it passes through customs, that is now seamless. It is very fast. So once it gets from the country into our lab, we can give you the sample results within 24 to 48 hours. I leave it at that at this point because we haven't started getting a huge volume. But before, we've been able to do some turnaround within hours, less than a day. But we're saying 24 to 48 hours because when the many samples, tens or more than 10, start coming in, we are committing to having it turned around once it gets to us in 24 to 48 hours.
Thank you.
Hi, Wendell Stephen, Power 102. I also have a dual role at the Port of Spain Corporation. I have quite a few questions actually. One is that can someone without symptoms at all pass this disease on to other people?
Can you let me answer you after each question?
Sure.
So that has been found in other regions. We have quite a bit of information about what happened in China, and asymptomatic persons have been in contact with others, and the others have become positive. I'm talking about like a family situation. In terms of if that is very common or the only way, no, it's not. Usually people are symptomatic. That means they have cough, difficulty breathing, and fever. But we do have instances where asymptomatic persons have been in situations where we realize that they spread. It is reported that they spread. Question number 2.
Yeah, the other one goes to the fact that the first case that would have been reported out of Wuhan, I think somewhere in early December. What do we know about when it actually started in Wuhan? Why I personally take an interest in that is that I was in China at the end of November. I left China November 28th. And where we were was in the province next to Wuhan. And whilst we were there, we heard nothing of this coronavirus at all. As a matter of fact, it was a conference with delegates from all over the world that were in China, and we all left around that same time. So what do we know about when it actually started in China?
All I know is when it was reported, and that was the end of December 30th. But why did you wait until now to tell us that? What did you do in January? Did you tell anybody that you had been there?
Fortunately for me, I'm on radio, so I talk all the time. And I've made that very clear, and I was wondering, why is it that we've never heard about when this thing actually started in China?
I don't know. I don't have any inside information with that. I can only tell you what the public health sources, as in WHO, would have told us.
And of course, the third question is children. I know most viruses affect children and elderly kind of almost simultaneously, but we have heard nothing about children being affected by this particular virus.
You have heard nothing.
Well, true.
But yes, there are two schools of thought about this whole issue of children. First, when it broke in Wuhan, there was some kind of break. I'm not sure what it was, if it was a holiday or what. And so in the earlies, children weren't that exposed. But since then, they've been researching what has been happening with children. And children do get exposed, but they seem to have very mild symptoms. However, if any of you was a Facebook friend of mine, I have a picture on my wall of a little child, 2-year-old child, who had been just released from hospital. So we do know that some children have been in hospital, but the majority have very mild illness. And they recover. So the whole issue of children, we've been researching it because we have an expert advisory group drawn from experts, practicing physicians with specialties in the Caribbean. As well, we also have the Pan American Health Organization has 2 members on that expert advisory group. And whenever these issues to do with the actual illness come up, we put it in the expert advisory group and we digest it. They do research, they give us the advice, and we meet every week to go over all of this. So the guidance that you see, especially the health sector guidance, that has been informed by the experts. Regional practicing doctors with expertise. We have a lung physician, we have a pediatrician, infection prevention and control, psychiatrist, psychologist, and a specialist in medicine. We have those persons who are advising us on all of this. So we've been looking at this thing of children. We even checked out the thing about in utero, that is when they are in the womb. We've checked out about breastfeeding, all of that.
So, doctor, let's say he didn't get tested. The symptoms would have been more than manifest by now, right?
I don't think he's shedding still, if that's what you're wondering.
Question about, as you talk about children, sorry, as you talk about children.
One moment,
sorry.
Mr. Fraser. May I ask, Mr. Gibbons has had his hand up for some time, okay. So I would like to ask Mr. Gibbons, to, unless he's going to allow you. Okay, just before you go ahead, I'm just going to allow 2 more questions, yourself and one other, before we go into the roundtable. Mr. Fraser, go ahead, please.
Yeah, as you talk about children, children from kindergarten right up to secondary school level, well, you assume that secondary school students should be more conscious of these things. Perhaps they are not. What kind of advice for the government here and across the region to deal with this thing about school children interacting with each other on a daily basis? Yeah, we don't have a case here, but soon enough, from all reports, it's inevitable. How do school children deal with these things?
So in the same way that we would give the advice that I just showed you for adults, we also want the parents and the teachers to keep drumming this. It's going to be different behavior, and behavior change is never easy, no matter your age. But we're going to keep drumming these things into the school setting. Of course, in the school setting, there are also different protocols that they have to put in place if there is importation and transmission in terms of hygiene, wiping down surfaces, doorknobs, etc., etc. All of us should be cleaning our cell phone screens regularly because cell phone screens are germ magnets. So these are the sorts of guidance that we are giving, and in terms of the other sectors, we are expecting that we will get support from other CARICOM institutions in making sure not only that the message goes out there, but at the country level, there is coordination, especially in the emergency setting, where there is planning. Each country should have something called a pandemic influenza preparedness plan. And we have been asking countries for quite some time now to take those plans out and custom design them for COVID-19. Those plans are not just for the health sector, they're for other sectors, including education. And the coordination of how that is done at the national level is something that we've been working to ensure.
We will have the final question for Mr. Gibbons, but we will allow you later on after the roundtable discussion to ask some more questions. We will also be taking questions from the Facebook Live. However, if all of them are not addressed in this forum, please be assured that we will respond, especially to those on Facebook. We will respond after the meeting. Mr. Gibbons, go ahead, please. No. Wesley, try the other one then.
Use my...
Thank you.
I have my sanitizer, so I'll deal with it after. No, Dr. Indar used that term more than once, sustained prevalence or sustained incidence or something like that. Is there sort of numerical threshold involved, or is it just a matter of case by case, country by country? And if so, what are the sort of like minimum measurements?
Thanks. There isn't a numerical number per se, but so it depends on, so sustained transmission is when you have the number of the increased cases in the countries cannot really be explained by just travel. So cases are occurring in the community, some are local and some are otherwise, but you cannot really explain. You're seeing those increase occurring very quickly. So I'm trying to just get away from all the scientific terms. So at that point, the transmission is occurring locally, within communities, and across the different areas very quick. So you're realizing then that it's not just transmission coming up from imported case, but there's transmission occurring and it's sustained, it's wider than normal. And so the country calls it. And they do that by, every country has surveillance. So for instance, at CARPHA, we monitor, we have something called syndromic surveillance. We monitor the syndromes on a daily basis. And the countries do that as well. So when they see that type of transmission of acute respiratory infections, which is the syndrome for coronavirus or COVID-19, they would then have to make that call and then decide. And this is where they say, well, okay, there's sustained transmission, and then they take different levels of proactive measures.
Thank you so much. We are going to address one of the questions from our Facebook live stream. Dr. St. John, can you let us know what the question is and the response, please?
So I'd like Stephanie Fletcher-Larty to take this question, and it is the whole thing about where the other countries that are testing.
Where they?
The 8 countries, yes.
Okay. So the countries in the region that have the capacity to test for COVID-19 are Barbados, Suriname, Guyana, Trinidad and Tobago, Dominica, Jamaica, Belize, Bahamas, and Haiti. And there are other countries in the wider Caribbean region that have capacity as well. These include Martinique, French Guiana, Curacao, Aruba, Saint Martin, and the British territories of Cayman and Bermuda will also have capacity. Thank you.